Hello guys, sorry I've been away for a little while, well for the past week. It's just been a lot going on recently, and I kind of wanted, this channel is kind of about miscarriage and miscarriage awareness, because there isn't a lot of it, and I just think there needs to be more of it. And okay, so this is just gonna be a miscarriage awareness video, so we're just gonna get right into this. Okay, 1 in 4 pregnancies end in miscarriage, and if you kind of just say it and don't think about it, it's kind of, you don't think it's a lot. That is a lot of pregnancies that end in miscarriage. In the United States, every 1 in 4 women have a miscarriage. That is a really high statistic. And this is just going to be a little information on what a miscarriage is, what happens during a miscarriage, the symptoms, the causes, the higher risks, just stuff like that, and just stuff to let you know what I went through and the things that I felt, and I'm sure that a lot of you guys have felt too if you've had a miscarriage or stillbirth or infertility or anything. I know you felt these same emotions that I have. But anyway, a miscarriage is the loss of a pregnancy within the first 20 weeks. It could happen in your first trimester, it could happen in your second trimester. If it happens in your first trimester, it's called a early pregnancy loss. If it happens in your second, it's called a late pregnancy loss. They call it a spontaneous abortion, which it has no reference into a willing abortion where you go in and tell them that you want to get rid of the baby. It has no relation to that at all. It's just what they medically call it. About 10 to 20% of known pregnancies end in miscarriage. 10 to 20% of known pregnancies end in miscarriage. So there's also another percentage that the girl doesn't even know that she's pregnant yet, and she loses it and just thinks it's her period. More than 80% of these miscarriages happen before the 12th week of pregnancy, which is before the second trimester begins. Studies show that 30 to 50% are lost before or even during implantation, which implantation is when the embryo or the egg, after it's fertilized, implants itself into the uterus, or tries to implant itself into the uterus, which happens 6 to 12 days after ovulation. The causes of a miscarriage. 50 to 70% of miscarriages lost in the first trimester are due to chromosomal abnormalities in the embryo. So the way that the doctors told me was that your body kind of, miscarried because the baby had something wrong with it to begin with. That's what they told me. Some miscarriages are caused by the egg, because it didn't implant right in your uterus, which is basically what I just said. It happens during implantation or before. Since most doctors won't do a full exam on a healthy woman after a miscarriage. It is almost impossible to figure out the cause of the miscarriage, which is a bit ridiculous. I think that they should do exams on every woman that's had a miscarriage so they can understand early pregnancy loss a lot better. These are the higher risk factors for miscarriage. Age. Age is a big one. If statistics show that older women are more likely to miscarry, 40-year-olds are twice as likely to miscarry than a 20-year-old woman. History of miscarriages. If a woman has had 2 or more miscarriages, it is more likely that she will miscarry again, which are called repeat miscarriages. Chronic diseases or disorders can cause miscarriage. Uterine or cervical problems. History of birth defects or genetic problems. Infections. Smoking, drinking, or using drugs. Medications such as ibuprofen and aspirin, which really kind of surprised me, but environmental toxins such as radiation or anything like that, like you get an x-ray done or anything. Paternal factors, greater risk if the father was exposed to mercury or lead and industrial chemicals and pesticides. Obesity, domestic diagnostic procedures, I didn't write them down, but I think it was like the IUIs or anything like that can also cause miscarriages. The signs and symptoms of a miscarriage. Of course, vaginal bleeding is most commonly the first sign of a miscarriage, but if you are, I'm not a doctor or anything, I'm not a professional, but if you're bleeding, you need to go, okay, there's a difference between spotting and bleeding. Spotting is kind of normal during a pregnancy because of implantation, but if you're bleeding and you're like going through a pad in like less than an hour, you need to go to the hospital. And if you're having clots too. Abdominal pain, it feels like menstrual cramps, really bad menstrual cramps. Lower back pain, pelvic pressure. Ways to pass the fetal tissue out of you. You can miscarry naturally, let your body do what it does and pass it on its own. Medication to help speed up the process, but it has really nasty side effects. And you may still need a DNC. That might not take care of everything. A DNC is a dilation and curettage, which is sometimes done by suction and sometimes it's done other ways. What is going to happen after you have a miscarriage? You'll have mild cramps and your bleeding may last a week or 2. Mine lasted about a week and a half, and the cramps were not fun. 1 in 4 pregnancies end in "why me?", which I think is a pretty powerful statement. There's just not much else to say about that statement. It's time to break the silence about miscarriage. Now I know there's a lot of angel moms and angel dads that do not like to speak about this because it hurts them, but it's got to come out at some point. And there really needs to be more awareness for this. There really does. So, and a lot of the stuff that I just read off is a lot of the stuff that I have went through. I went through it in February, and I pray to God it does not happen to me again. And here it is 2 months and 3 days later, and nothing's gotten any better. You forget for a little while, but then reality smacks you in the face. It's like, hey, you're supposed to be 3 months pregnant right now. It's hard. But if anybody needs anybody to talk to, I'm here. You guys should subscribe and like. There will be more videos to come, and probably it's gonna stay about miscarriage awareness and infertility and infant loss and child loss and stillbirth, and I'm within the TTC community right now, and Instagram has been amazing. I've gotten so much support from strangers, it's crazy. So what I advise you guys do is either vlog your life, like I'm doing, talk about it, because YouTube was my outlet, and it still is. Write about it in a journal, which I did. Write quotes down, write poems down, write a song. I kind of went to YouTube and Instagram. You make a miscarriage account on there, and those people in there are really wonderful. They're awesome. But anyway, this is the end of this video, and it's time to break the silence.